What is up, you guys? So today I'm going to be filming a vlog of my quarantine and my daily routine, what I do every day. And so yeah, we're just gonna start off right now. I'm just eating, and oh, looks like I just got an email. Let's see what that is really quick. Okay, so that was a weird email, but what does he mean by having evidence provided from him? Where am I gonna get evidence on such short notice? That was weird. I wonder who's at the door. Package for Abishin. Have a nice day. Thanks. Okay, so I just got delivered this big old envelope. Okay, so when I first open it, there's a thing that says Meet Anna Garcia. And, well, this tells like all about the crime scene and everything. Alright, looks like either it's her footprint or somebody else's walking in. And there's a syringe right here. Must have had some type of medication. Somebody's hair right there, might be hers. And someone's fingerprint is right here. That's pretty valuable to this case. Looks like she was taking some pills or something. Maybe she fell off her stool too. And it looks like she had some juice and she must have dropped it when she fell. And it looks like over here, if you come over here, looks like she must have thrown up and hit her head and blood. So there was also some information on suspects, and I think that we should bring them in and talk to them about this case to figure out some more big details on what this happened. How are you? Would you like a glass of water?
I'm good, and okay.
Well, too bad. I wasn't going to get you a glass of water. What is your relation to Anna Garcia?
We used to be married.
Was it a good marriage?
Well, we fought and argued a lot before we got divorced.
And aren't you married now?
Yes, my wife is expecting a baby.
Well, isn't it a little weird to be married that soon after a divorce?
No.
Well, I think it's a little suspicious. And aren't you still having financial troubles? And you're still on Anna's life insurance?
Yes.
Well, I think that's a little weird. When did you last see her?
The night before she died.
Well, that's a little weird in my opinion, but that's all for now. I'm done. Hey Doug, how have you been?
Pretty good.
Well, I'm not. What is your relation to Anna?
We're neighbors and we used to go out.
Oh, really? Why did you break up?
I don't know, she just ended it suddenly.
Oh, that's weird. Now, weren't you the one who called the police?
Yes, she walks her dog every morning and she hasn't been walking her dog very often anymore.
Alright, thank you. That's all the questions I have for you. Hey girl, how you doing?
Good?
Alright, cut the knives out. You're Alex's new wife now, aren't you?
Yeah.
And had you seen Anna any time recently before she died?
Well, I was in my car across the street from her house the day before she passed.
And why were you?
I don't know, I just was.
Alright, enough questions. Hey, would you like a glass of water?
No, I'm okay.
Well, too bad. I wasn't going to get you one anyway. And your relation with Anna was best friends, right?
Yes.
And you two both work at the local bakery together and co-partner, right?
Yes.
And you've been wanting to expand the business, but Anna keeps saying no, and it's been causing you two a lot of arguing, hasn't it?
Yes.
And when did you last see Anna?
At work, the day before she died, she left early because she said she had something.
Alright, thank you. Yeah, that's enough questions for me. So there's some more evidence in here, some more crime scene evidence that I found. And it shows that the blood found at the crime scene was Anna's. And that it was her hair at the crime scene and her footprint at the crime scene, but that makes sense. But it also says that the fingerprint at the crime scene belongs to Alex. But we have to think about that Alex actually did used to live at this house, and his fingerprints are probably everywhere. So I think we can really rule out that this wasn't a homicide. I really think that it was probably something to deal with, something in her own medical problem in medical history. Okay, there's also this journal in here, and it's like starting from age 10. It says, Anna, age 10. Sometimes I really hate the sickle cell thing. It's always getting my way, and I can never do anything, and I'm always missing out on school and my friends. And last month, I couldn't even go to my friend's birthday party because I was in so much pain. And none of my friends understand what I'm going through at all because no one else has this. Well, now I got to go to physical therapy so they can help me out of bed and help me do some exercises so that I won't feel as bad. Talk to you guys later. Age 17. This is my second month on hydroxyia. The doctor decided it would be a good idea to start since I've had so many pain crises this past year. They said it's a pretty new medicine and it should actually help me live longer, and it should make me have fewer pain episodes and keep me from getting acute chest syndrome again. And it has a lot of side effects that are making me nauseous and tired, and it's making my hair fall out, which is not okay. And I'm trying to stay hopeful through all of this, but it's really hard because nothing's getting better and it just feels really bad. Age 22. My orthopedist says my vascular necrosis in my hip joint is getting worse, which is making walking become more challenging. Apparently, the last x-ray showed that the round ball of my bone is all rough and jagged. The doctors say that my bone is basically dying, and the main artery that supplies the blood to the bone has been blocked again by sickle cell. And it still hurts, and I'm faced with the decision of whether or not to proceed with a hip replacement. My parent thinks I should. I'm not as Momo as I would like to be, but maybe it would be worth it. Age 31. I married my best friend Alex a few years ago. Things between Alex and I have been going very well, and we've been talking more about starting a family. That being said, Alex has sickle cell trait, which means the genetics are really not in our favor. During my appointment last week, my hematologist recommended Alex and I meet with a genetic counselor. I suppose I should just go ahead and make the appointment with the counselor to find out more. It can't hurt, right? So these are all the things that were recorded in Anna's food diary that she was eating days before she passed. And there are some healthy foods, but there are a lot of things she probably shouldn't have been eating due to all the medication and all the health problems that she had. Okay, so at 4 months old, she came into the hospital because she was having trouble breathing and her breathing was abnormal. And it says that she had pale skin, nails, and lips. And her heart rate was a lot higher than her normal range should have been. And she was going to the bathroom a lot more than a normal 4-month-old would. And so her CBC test, her red blood cell count was reduced and her white blood cell count was increased. And then they took a sickle cell test, and she tested positive for sickle cell anemia. And she hadn't really had many major illnesses since sickle cell, but recently she's been reporting that she has been fatigued and not been able to finish her normal activities because she's been getting tired and she needs more rest. And she also drinks a lot, and no matter how much she drinks, she still feels thirsty. And her mom has been noting that she has been going to the bathroom a lot more normally than usual. And she's lost 10 pounds since her last visit, even though her diet has not changed, and she's been not able to do as many activities because she's been so fatigued. Okay, so this is her report from age 37. She now does have type 1 diabetes and sickle cell disease, and she was referred to have a full cardiac evaluation after 2 incidents of self-resolved chest pains. And she's a non-smoker, but she has admitted to having a diet high in both fats and calories, and she consumes 3 glasses of wine each day after work. And she used to be an athlete, but she has not kept up to her workouts and stuff to keep in shape. And she took her cardiac testing, and it says that she completed the treadmill stress test, and she experienced drastic increases in blood pressure as well as a few premature ventricular contractions on EKG during the exam. And she was monitored for a while, and there was a couple abnormalities, and she was only able to walk for 8 minutes before the test was concluded at a max speed of 3.5 miles per hour and an elevation of 2%. And her max blood pressure was 190 over 110, and she was having a lot of changes in, she complained about her chest pain a lot during the cardiac test. And it says that she now had history of sickle cell anemia, diabetes, heart disease, and hypocholesterolemia. And she was admitted to the hospital for extreme pain associated with her sickle cell crisis, and she reported fatigue and extreme pain in her legs. And her pain in her legs was so bad while she was there that she was confined to her bed and required to have a urinary catheter to empty her bladder, and after her 5 stay in the hospital, she was released, and 1 day later she was noticing strange urinary symptoms, and she was feeling a persistent urge to urinate, like she had to go to the bathroom a lot, and her urine appeared to be cloudy and slightly pink in color, indicating that she had a UTI. And since she was recently in the hospital with the catheter, she was suspected that the infection was acquired during the hospital stay, and a sample of her urine was sent to a laboratory to identify the exact pathogen responsible for the infection. And the results were that she tested positive for a bacterial infection. So that's all of her medical history documents, and it really shows she had a lot of problems growing up, all the way up to before she even died, like a week before. So in her autopsy report, it says there was no evidence of alcohol in her at all, and in her stomach there was no evidence of toxins or poisons. It was just the food that she'd been eating for the last couple days. And it also shows that she had hydroxia trace amounts in her blood because it was treating her sickle cell anemia. And let's see what else there was. And there was no evidence of non-prescription drugs or overdose of them in her urine, but there was ketones in her urine, which is not good. And her left kidney appears to be pale and shows beginning signs of necrosis. And her right eye appears cloudy, and her blood vessels in both eyes are swollen, and they're abnormal in the left retina, and vision is most likely compromised. Appearance was there was oxygen deprivation, like lack of oxygen, and her fingernails and toenails were blue/gray color, and there was vomit and the oral activity, and blunt trauma to the head. There was a wound indicative of a fall against a solid object, and there was light bleeding, lack of blood flow, and edema of ankles was visible. Her ankles were swollen. I believe that she died from uncontrolled diabetes, which caused her sugars to become so high, and she never did anything about it. That caused her to have blurred vision, make her vision more cloudy, and her blood vessels to be swollen in both the eyes. And it caused her to have that urinary tract infection that they had found a couple days before she passed. And that lack of oxygen that she had left her nails that blue and gray color, and the edema in her ankles, which caused them to be swollen, and the left kidney to be pale and showing beginning signs of necrosis, showed that she had kidney problems, which could be from her uncontrolled diabetes, and she also had heart problems, like her mitral valve did not close properly, and her right coronary artery was 80% occluded, and the narrowing in her arteries and clogged arteries also showed problems of heart, which all come from her uncontrolled diabetes. So that is why I believe she had died, and my evidence to bring it back to it. Thanks for watching. Have a great day.